Meet Thandi. She's just landed her very first job at a large manufacturing plant. But before she starts, she must first meet with the health nurse. First, she will get a pre-employment health screening. The nurse will check her vision, hearing, and lung function, and also check the overall well-being of Thandi. This is when Thandi discloses any health conditions she might have. And all of this is to make sure Thandi is fit to work safely in this noisy, sometimes dusty environment. On her first day, the nurse leads the orientation. Thandi learns about workplace hazards, how to use protective equipment, and what to do in emergencies. Over the next few months, Thandi meets the nurse again for routine health monitoring. This is where they check regular hearing tests, lung function tests, and any early screenings. When Thandi feels stressed, overwhelmed, or even gets a minor injury, the nurse is there with first aid, counseling, and referrals. And if Thandi ever needs medical leave, the nurse will help her to return safely, either with modified duties, support, and guidance until she's fully ready. So, ladies and gentlemen, meet your occupational health nurse. So, your occupational health nurse is your frontline defenders for workplace wellness. They ensure that employees perform their duties without risking injury or illness. So, what do occupational health nurses do? Occupational health nurses, they conduct pre-employment health statuses. They need to know that the person who's going to be employed in this company, what sort of health conditions do they have, and how these health conditions is going to impact their work. And they also need to have a baseline of where the employee's health status is, because as you're doing your job, workplace injuries do happen. It's going to affect either your hearing, your sight, your speech, etc. As a result, when they see these deterioration of the clients, they need to know what their baseline was, and also then they can help determine how much effect they've taken in as a result of being in this workplace. For example, with Thandi, she's working in a manufacturing plant, it is loud, etc. So if you know the baseline of, okay, her hearing ability was at this point, and then maybe after a month, okay, her hearing ability has decreased, as a result, her workplace has affected her well-being, the occupational health nurse will intervene. So that's your pre-employment checks. The next thing is obviously they perform routine health surveillance such as hearing, vision, lung function tests, because these are all early signs of occupational health illnesses. Second thing is they manage workplace injuries and emergencies. So workplace injuries can be someone cuts themselves, someone is hit by something, someone falls, etc. And some of these emergencies can either be as a result of the job that the employees are doing, or as a result of different health conditions that the employees have. For example, your diabetic patients, if they are working for long periods of hours without eating something, they are at a risk of falling. Or it can be someone who is diagnosed with epilepsy or seizures, and certain things in the workplace might trigger them, even though they might be on treatment, they're managing their seizures, etc. They might have seizures in their workplace, and the occupational health nurse will have to deal with these emergencies. The next thing is they run safety training and health education programs to prevent injuries. They need to educate the employees of, okay, if you're working in this environment, maybe there's so much noise, maybe there's things falling from the ceiling, whatever. Obviously, they need to have their hazmat hats on. They need to make sure that they're having the correct shoes on. They need to make sure that they have those ear muffs to make sure that they are decreasing the amount of noise that they impacted with in that workplace. So it's about making sure that the employees are wearing the correct PPE for the work that they're going to be doing. And obviously the last thing that they'll be doing is helping companies comply with occupational health and safety guidelines. I'll speak later on about the difference between your occupational health safety officer and an occupational health nurse. But ultimately, your occupational health nurse, they need to understand what occupational health and safety policies are so that they can enforce them, and then they can assist with the employer to say, okay, this is what we're actually expected to be doing, as a company. This is how it impacts employees to make sure that you're following those occupational health and safety policies. So as you can see, every single company needs to have an occupational health nurse. This nurse needs to ensure that all the employees in this company, they're following the policies, and also you're ensuring that you're keeping them safe from any occupational hazards and illnesses that they may develop working in this workplace. So whether they're working an office job, working in a manufacturing plant, whether you're working in a mine, etc., you need an occupational health nurse to keep your employees safe. Okay, so because of the different workplaces that they're working in, your manufacturing plants, your mines, etc., because your job is going to be on prevention, making sure that the employees don't get hurt. As a result, you're going to be working a typical 9 to 5, aka you're going to have a corporate job, and as a result, you are less likely to work night shifts, you are less likely to work weekends, which is amazing if you're someone who just wants to have the 9 to 5. You're still dealing with patients, even though it's clients in like a workplace setup, you're still seeing clients and patients, you're still providing health education, you're still practicing your nursing skills, but in a more corporate setup. So what are some interesting workplaces or opportunities that occupational health nurses can find themselves in? So as an occupational health nurse, you can either be at one company, whether that's a manufacturing company, whether that's a mining company, whether it's a big corporate finance company. You can be stuck in one company, or you can be an occupational health nurse in multiple different companies. So usually companies that do that is your small, medium companies, because obviously they cannot hire to have one occupational health nurse in one small company. As a result, a group of small, medium companies that can say, okay, we'll pay your salary as a group, and you just see our employees in these different setups. So as a result, you can work in a wide variety of different environments, whether you're doing these pre-screening tests, whether you're doing your safety and hazard checks, you're making sure people know how to put on their PPEs, etc. Or you might be involved in creating training or wellness days where you are teaching your employees on how to take care of their diets, how to make sure that they're constantly hydrated. If any of them are dealing with chronic conditions, you might do wellness checks, either to check their sugar levels, their blood pressures, giving health education. I think Discovery is one of the companies that I see do this a lot, where they have wellness days for their employees, and sometimes they even extend it towards their customers. So if you like your bank with Discovery, they'll have wellness days where you will have an occupational health nurse who is going to speak to you about your health. That can be something that you can be involved in. And the other awesome thing is you can either work with companies that are overseas. You can actually be a telehealth occupational health nurse, where you do virtual consultations with the employees there. You do the screening over the phone, and then you just tell the employees, okay, you need to go to your local GP, whatever, then you have these and these and these tests, and then you keep the record of everything. Then you'll be the one organizing the check-ins of, okay, whether you're doing a check-in every month, every quarter, etc. You'll be doing the admin work, giving reminders to the employees to do their health checks, etc. And then you just be doing that remotely. That's also another opportunity you can get involved in. Other occupational health nurses you might find on ships or refineries, etc. Any big corporations that have a lot of employees, or companies that deal with hazardous occupations, all of them, they would require an occupational health nurse. And I know right now people say the mining is where the money is. That is fair, but I would say that your ships are the ones that have the most money. Just saying. Okay, so what does a typical day look like for an occupational health nurse? So you might start your day with either you're giving a health education to new employees and saying, okay, this is the safety, this is where you find your first aid kit, this is where you find your PPE. Then you might move into doing pre-screening for any new employees that might be coming into the company. Then after that, you might be reviewing patient records to say, okay, this person, I saw them a month ago, okay, we need to do a review of their hearing, their vision test, or their lung function. Or this client is diabetic, okay, we need to see how they are managing their sugars. Or this client was started on high blood pressure medication, or this client was started on ARVs. Okay, how are they managing with that, etc. Then a few other things you might do is you might respond to workplace injury, you might meet with management about compliance and the safety issues, or you might have a meeting with your occupational health nurse or your infection control personnel. That can either be a nurse, specialist, etc. So this job involves clinical work because you're actually physically seeing the clients, you're doing the tests, etc. It also involves admin because you have to keep records of all these clients that you're seeing, and also it involves a lot of education. So if you're like a variety or a mixture all of these things, then this could be a perfect role for you. So I just want to explain the difference between two roles that do work hand in hand with your occupational health nurse, but they mustn't be confused with the roles of an occupational health nurse. So you will have your infection control nurse and you will have your occupational health and safety nurse. Their duties, they do interact with what an occupational health nurse, but it is different. Your infection control nurse, they specialize specifically in preventing and managing infections within the healthcare setting. So infection control nurses, mostly you'll find them in your hospitals, but you can also have an occupational health nurse in a hospital. But the infection control nurse is about preventing infection. So they're dealing with patients that have these infections and ensuring that the employees or the nurses or the doctors in that ward, in that hospital setup, they are not acquiring these infections in a hospital setup. So they're the ones that will be telling you about hand washing, gearing the hand hygiene issues. They'll be telling you about the PPE that you're supposed to be wearing. They'll be telling you what type of isolation a certain patient is supposed to be in when they have a certain illness. Whereas occupational health nurse, they're more about managing the employee's health in a healthcare setup. Yes, they might educate you about the PPE that you're supposed to be having on. Or if, for example, when we had COVID, your occupational health nurse would have to enforce putting on masks, would have to enforce hand hygiene. Even though they are not an infection control nurse, they would have to enforce that because your main priority would be the employees' health and wellness. Okay, then you have your occupational health and safety officer. So your occupational health and safety officer, they are there to find out what hazards there are in the workplace that can harm the employees. So yeah, they are there to do hazard identification. They are there to ensure that you're following safety policies and compliance enforcement. For example, in a workplace, you need to have bathrooms in a certain radius. You need to have fire extinguishers. You need to have fire escapes. If you're going to be having a fire drill or an actual fire, there needs to be a plan that has been drawn up that employees can see and follow of, okay, when there's a drill or when there's a fire, this is how we exit the building. Okay, if there's machinery is moving in the workplace, okay, what are the different safety measures that you're putting in to make sure that no one gets hurt? Okay, if you're using sharp materials to cut things, to drill things, etc., what are the hazards that are put into those places to ensure the safety of the employer? So even though they might be there to protect the employees from experiencing harm, safety officers, their main role is to identify the hazards in the workplace and say, okay, this is what you're supposed to be doing to prevent injury. And then your occupational health nurse comes in and say, okay, even though there is these hazards, this is how you will keep yourself healthy and safe in this environment. Therefore, then they'll start teaching you about PPE, how to take care of your health, etc. So your occupational health nurse and your occupational health safety officer, they do work hand in hand, but the safety officer is more focused on the working environment, whereas the occupational health nurse is focused on the employees specifically. Okay, so how do you become an occupational health nurse? So obviously you need a nursing degree and you need some experience, whether it's in emergency nursing, ICU nursing, general nursing. You need to have some form of experience as a nurse because you need to know obviously how to do basic nursing. You need to know what signs and symptoms to pick up if someone has a certain illness, etc. Then obviously you need to get extra training. So this extra training can either be you getting a postgraduate diploma in occupational health and safety. Okay, so there's a few certifications or a few things that you need to get in addition to you having your diploma in occupational health nursing. The first one is you need to join the South African Society of Occupational Health Nursing. So it is the professional body of occupational health nurses in South Africa. So the same way that you be joined to the South African Nursing Council as a registered nurse, you also need to join to SASON, because they will ensure that you are practicing. They'll give you a scope of practice as an occupational health nurse. They need to also ensuring that you're keeping up with your CPD points. Every profession, they'll be involved with CPD points, and they need to ensure that you're compliant, and as a result you will also need to pay an annual membership fee. You'll be paying it at SANC, but you also need to pay it at SASON. Then the other trainings that you need to have is your audiometry and spirometry certificate. So your audiometry certificate is obviously when you're testing the client's hearing, and then your spirometry certificate is when you're testing like your lung function and detecting conditions like asthma, COPD, etc. So these certificates, usually it's part of your postgraduate diploma in occupational health nursing, but if your degree does not offer that, it is highly advisable that you get the certification, because this is something that you're going to be doing in your workplace on a daily basis. Then you also need to do vision screening certificates, and then I would also highly advise for you to get a dispensing license, because obviously if you're going to be working with employees, they're dealing with different health conditions, because of your scope of practice as a nurse, you can only dispense medication, Schedule 1 and Schedule 2, which is your over-the-counter medication. And also you're not allowed to prescribe medication independently if you're working independently as an occupational health nurse. As a result, if you have a dispensing license, you'll be able to give this medication in your healthcare setup. Then the other thing is obviously if you can do HIV counseling and testing certificates, because you need to know the status of the employees that you're working with. They're going to be dealing with different emergencies, blood might be spilled, etc. You need to ensure that you know everyone's health status. Some clients might find out for the first time when they're admitted in a hospital, etc. And you can offer those services of HIV testing and counseling in your workplace. Then obviously you need to know how to do basic life support and ACLS, because emergencies will happen in your workplace. The second thing is obviously phlebotomy and blood collection competency. You need to take blood. Some clients you need to do extra testing. Then you need to know how to do ergonomics, which is training on workplace ergonomics, on how jobs on workstations affect your posture, strain, injuries. Remember, you are there to keep your patient's wellness. As a result, that also involved with the amount of strain that you are taking on working in different environments. We actually should have these nurses in hospital, because the amount of strain that we take when we're lifting those patients. Anyway, story for another day. Then also you can do what is known as a safety management training. This can be in addition to what your occupational health and safety officers do, where you're learning about the different policies that your occupational health and safety officer will be enforcing, because if you understand them, you'll be able to better prepare and provide care for your employees. If you understand what the policies are, okay, if something is meant to be at a certain height, okay, how is that going to affect how my clients are going to lift things? How is this going to affect the employees, how they're going to be moving, the ergonomics again? It's also going to affect where your PPE is meant to be. So if you understand those policies, it also helps you to do your job better. And then the last thing is obviously if you can become a first aid instructor. It's not necessary. If you're not BLS, you are fine, but it also allows you to be able to train your staff in first aid if you yourself are a first aid instructor. So as you can see, there is a lot to do as an occupational health nurse, and I think it's a really fun environment to work in, because you're still doing your clinical work, but you're in a corporate setup and you're still educating patients. So if you like all of those things, you want to be in a corporate setup, you want to be working your 9 to 5, you don't want to work weekends, but you still want to interact with clients even though they might not be your patients, but you also like that independence of being able to see employees on your own, doing these tests, working independently, either providing them with education on how to treat their illnesses, etc., then this is an amazing role to get into. and there is a wide variety of different environments that you can work in. As a result, your earning potential goes up exponentially, especially if you're working in your big manufacturing companies, if you're working in your mines, if you're working in your cruise ships. The earning potential there is very high. And obviously there's very few occupational health nurses, because like I said, the more niched you are, the higher your earning potential, because you can negotiate your salary. There is fewer. As a result, the demand is more than the supply. As a result, your pay will be more, because they want to attract the nurses that are specialized in these different things to get in. So as a result, occupational health nurse is a highly lucrative field to get into. Obviously, I'm not saying get into it for the money, but I'm saying the pros of getting into this specialty outweigh anything else. So if you want the great working hours, the better pay, and the independence, top notch. So that is all I have for you regarding occupational health nurse. You can go down in the description box. I did make a summary of all the extra certifications you might need to learn. I've also put links of the different universities and colleges where you can do a postgraduate diploma in occupational health nurse to get you started on your journey. So until next week Friday, where we're going to be discussing about corporate nursing. Yes, occupational health nurse is like an introduction to corporate nursing, but next week I'll go more in depth into what other careers you can go into if you're someone who wants to leave bedside nursing, you want to find other careers that will give you more flexibility in terms of your time, etc. You can get into that. So until next week Friday, 12 p.m. South African time, have an awesome day. Bye guys.